Hello, everyone. Good evening, everybody. I'm Sanyukta from Bladder Wellness Team, and I'm sure all of you must be keeping good health. Today, we are going to discuss a very important topic benign prostatic hyperplasia, BPH. BPH is the non cancerous enlargement of the prostate, usually begin in 50s in men, and in many men, it may cause obstruction to urine flow. Many men have to get up and go to the toilet at night, and is the most troublesome aspect of this condition as it makes them tired and fatigued during the day. Having to urinate frequently during the day, sometimes with a sense of urgency, can also be tiring for patients and can make traveling or attending events such as theatre, cinema, social gathering, etc., rather difficult. A doctor, such as a urologist, can treat this condition and help the patient to get ready. So, to throw more light on the subject and guide us on what's right for diagnosis and treatment of BPH, today we have with us renowned urologist Dr. Sagar Bassi. He is MBBS, MS, M.ch urology. He is urologist and andrologist for male infertility, and currently he is practicing at AIMC Bassi Hospital, Ludhiana. Dr. Sagar Bassi has rich experience in the field of urology and carries out the diagnosis and treatments with utmost precision and efficiency, ensuring that patients' health is in safe hands. A very warm welcome to you, Dr. Sagar Bassi.
Hello, hi Sanjita. How are you?
I'm good, doctor. How are you doing?
Very fine. Yeah.
And today we are going to talk about a very important topic, or I should rather say, a very common problem with men, especially after a certain age, after 45 or 50, that is BPH. First of all, doctor, because the whole issue is related to the prostate, right? We are talking about the non cancerous or benign enlargement of prostate. First of
Yeah.
all, what is prostate? Why that gland is important. We would like to start from there.
So, Sanjita, to know any disease, we need to know what it is, from where it is arising, and what is it that is causing that problem to the person. So, if the patient knows that what the problem is, from where it is arising, so he has a lot of limelight on the subject, and the treatment becomes very easy. So for that, the patient needs to know what is prostate is, as you asked. So prostate is basically a gland which is present in only males. It is at the neck of the bladder, urinary bladder, and on the way of the urethra from the where the patient pees, and it's almost of size of a walnut. And it is present at birth itself in males, but with age it grows, and it is the only gland which has androgen receptors which are alive for the lifetime. So the it keeps on growing with your androgens and hormones, and in at a later age, it grows to such an extent that it causes some problems like frequency of menstruation, difficulty in urinating, making it a compression in the lumen of the urethra. It is not growing in the urethra, it is compressing the urethra at the neck of the bladder. That is causing the whole of the problems, all of the symptoms in the patient, and all the symptoms and all the problems patient comes to us with.
Right. Now, you have very well explained, doctor, what is prostate and also what is BPH, benign prostate enlargement, which we normally call in general. Now, doctor, as you said, it's a very, it's like a sign of aging. जैसे हम
Right.
age करते हैं, we see certain signs and,
Definitely.
like fraying of hairs या wrinkles है
Mhm.
face पर. उतना ही natural क्या prostate का
Definitely. Definitely, it is totally natural. It is benign prostatic hyperplasia. That is the growing of cells and enumerating. The more the cell grows, the more gland grows. So, as I told earlier, that it has androgen receptors in it, right? So our body keeps on producing hormone. In other parts of our body, say it like in a male, his genitals, the androgen receptors are of of no use after puberty. But in prostate, it works after puberty throughout his age. So naturally, the androgens, the testosterone, and the other hormones are working on it and making it grow throughout his life. So it's a natural process. The only thing that matters is how much it's troubling to the patient. Is it causing him any problems? Is it causing him any symptoms? Or is it causing him a normal life? Is he living with it with a normal life?
Right. So now
Yeah.
coming to these problems which you just mentioned, Initially, you said that there are symptoms like you have problem with the because urethra, passes through
Yeah.
the prostate और इसीलिए शायद ये सारी प्रॉब्लम
Right.
होती है. तो ऐसे में symptoms क्या क्या है डॉक्टर? You said
So,
people have large prostate face some
mhm.
urinary problems. What are those?
So the main symptoms that are associated with prostate is the obstructive symptoms or the overactivity symptoms. So the obstructive symptoms come up like the decrease in flow of urine. Some patients have to wake up multiple times at night. They have to hesitate to urine. That means to start the urine, they need to wait, they need to relax themselves, and then the micturition starts. And sometimes the flow of urine goes down. The patient has to go frequently to urinate after half an hour or 1 hour. That is not normal at all. And also, it is associated with the incomplete evacuation of bladder. That is the feeling of incomplete emptying of the bladder. The patient goes, he urinates, still he has that feeling that I need to urinate again. मेरे को दोबारा जाना है, मेरे को दोबारा यूरिन करके आना है, मेरे को पूरी तरह रिलैक्स आउट नहीं हुआ. So these are the main symptoms of the prostate. And in our society, a lot of people think that it is associated with age. मेरा
Hmm.
flow कम हो गया है, age है.
Hmm. Your mic is muted, doctor. Yeah.
It is the prostate that is causing, and people need to know if they are having this problem, no matter what the age is, they are 50, 60, 70, 80, they need to consult a urologist or any good surgeon to get it evaluated and get it treated.
राइट, ये आपने बिल्कुल सही कहा डॉक्टर. आमतौर पे ये जो सिम्पटम्स है इसे हम एज के साथ एसोसिएट कर लेते हैं या फिर क्योंकि एक सर्टेन एज के बाद डायबिटीज बहुत कॉमन है,
बिल्कुल.
दूसरे इस तरह की प्रॉब्लम्स बहुत कॉमन है और कई बार लगता है कि अब तो इसके साथ रहना ही पड़ेगा. ये तो एज से रिलेटेड है. जितना नेचुरल हमारे बाल सफेद हो रहे हैं तो बाल के लिए तो हम कलर करा सकते हैं, लेकिन इसके लिए शायद और कोई तरीका नहीं है. इसके साथ तो हमें रहना
Yeah,
ही है. लेकिन जैसा कि आप कह रहे हैं कि ये कंडीशन है और अगर एक मेडिकल कंडीशन है तो आई एम श्योर उसका ट्रीटमेंट भी होगा. So what
definitely.
are the options?
So, before the treatment, I would like to tell you that we need to go to the diagnosis of the disease. Whether the patient is having the prostate, is it the prostate that is causing the problem, or it is something else that is causing the problem, right?
Hmm.
So, diagnosis starts with the patient history itself. It is a symptomatic disease, doesn't matter what size of the prostate it is, but if the patient is having symptoms, he is having some degree of obstruction, he needs to be evaluated and diagnosed for the disease. So for the first thing to get diagnosed, it's a simple ultrasound, which is available at every round the corner of our city, our state, everywhere now ultrasound is easily available. So patient can easily go and get an ultrasound abdomen with KUB with post-void residual volume as well. That is very important to know after he micturate how much urine is residual in his bladder after he is micturating. After that, there comes to other investigation to degree the severity of the disease. That is uroflowmetry. Uroflowmetry is a simple test. It's a very simple test. The patient just need to void in a kind of machine, and that tells how the flow is. Is it an obstructive flow? Is it mild obstruction? Is it moderate obstruction? Or is it a severe obstruction for which he needs a very defined treatment? So after that, it comes to the PSA levels, which is also important in any patient. I think it is important for everyone and each male after the age of 50 to get himself uh, PSA done once in a year or 2 years, 3 years, because PSA is an indicator for prostatic cancer also. So sometimes after age of 50 with benign prostatic hyperplasia, there is a shared CA prostate as well. So PSA is a very good marker for that, baseline marker, but definitely screening should be done for that as well, especially if patient has a history, family history. After it comes to the normal routine evaluation of the patient with urine evaluation, etc. Then we can talk about the treatment.
यस, बिकॉज डॉक्टर आपने पीएसए का जिक्र किया और आपने कहा कि ये बहुत जरूरी है कि आफ्टर एक सर्टेन एज हम पीएसए जरूर करवाएं. सब मेल के लिए ये बहुत जरूरी है. एंड चूंकि हम बेनाइन एनलार्जमेंट ऑफ प्रोस्टेट की बात कर रहे हैं तो आई एम श्योर कैंसरस प्रोस्टेट भी होगा, बेनाइन यानी जो नॉन कैंसरस है. तो
Yes.
पीएसए इसलिए भी जरूरी है ताकि हम रूल आउट कर सके कि
Yes,
कैंसर.
definitely it is important.
सो इस पर हम और बात करेंगे, लेकिन हाँ, उससे पहले डायग्नोसिस का हमने समझ लिया। अब व्हाट आर द ट्रीटमेंट ऑप्शंस अवेलेबल?
So for the treatment option, it depends on the symptoms of the patient, not the size of the gland of the patient. So there are a lot of my patients coming to me with a size of say 30 cc, 30 gram prostate, and are having severe symptoms, right? And they need extra treatment for that. And there are some patients who are having 80 cc gland, 80 grams gland, but not having that much of symptoms. They have just mild symptoms. That all depends on the growth pattern of the prostate, basically. Is it growing intraurethral or it is growing outside the urethra? No matter what the gland size is, if it's going outside the urethra, it's not compressing the urethra, the patient won't have that much of symptoms. But if it is
Right.
going inside the urethra, it will have more symptoms. This I wanted to discuss because a lot of people ask this question, sir, हमारा तो prostate grade 1 ही है, हमारा तो prostate grade 2 ही है, हमारा छोटा सा prostate है, इसमें हमें क्यों इतनी दिक्कत हो रही है? Most of the normal general practitioners guide the patient basis on the size of the prostate, but actually it is not the scenario. We need to see the symptoms of the patient. So after seeing the patient, recognizing the problem, we can just enumerate him as a mild problem, moderate problem, or a severe problem. So the mild problem, in a mild scenario, you can just go for wait and watch, or you can give him some medical treatments. Similar for the moderate patient, can be given some medical management like alpha blockers and 5-alpha reductase inhibitors are there, which help in relaxing the bladder neck basically, and increases the flow of the urine and decreases the symptoms. But in a scenario of a severe uh, obstruction where the patient is having a lot of symptoms, it's troublesome, it's affecting his quality of life, as you initially said that they have a troublesome mornings after multiple episodes of nocturia, and also if he is resistant to the medical treatment as well. He has been taking a medical treatment from so long, and still he's having some problems like like these symptoms are there. So we can definitely go for a surgical management in these patients. And the surgical management nowadays, it's very effective and very easy going on the patient. Earlier, they used to do open prostatectomies, which were very troublesome for the patient. Patient has had to have multiple pipes in him, etc., on a SPC, suprapubic catheter, and a catheter from down, etc. But now it has been an endoscopic procedure. It is all done by bipolar or a laser, by endoscopically via urethra only, without any cut, without any incision, without any effect on the patient's life. And patient goes home the next day or a day after, and he's happy with itself, and has a very quick recovery. So basically, what we does in this surgery is we go through the urethra. Either there are two methods to doing it. It is done by laser, that is HOLEP or THOLEP nowadays, thulium laser or helium laser. That is the latest techniques to do that, in which we enucleate, we remove whole of the prostate that is obstructing and remove it from the bladder itself, from the urethra, from the endoscope itself. Or the old technique of TURP, transurethral dissection of prostate. That is a gold standard as well. In that is also the current is used, a monopolar or bipolar current is used, which end results are more or less same and gives the equal results to the patient.
बिल्कुल। तो ट्रीटमेंट ऑप्शंस अवेलेबल है। ज़रूरत बस इस बात की है कि अगर ये सिम्पटम्स हैं, देन प्लीज़ गो एंड कंसल्ट अ यूरोलॉजिस्ट, दे विल हेल्प यू।
Definitely.
डेफिनिटली क्योंकि क्वालिटी ऑफ लाइफ तो हैम्पर होती ही है अगर इस तरह के सिम्पटम्स हैं, आप रात में ठीक से सो नहीं पाते हैं, दिन में आप टायर्ड फील करते हैं, फटीग फील करते हैं, thus it becomes very important to get relief of these symptoms, and for that you need proper diagnosis, proper treatment. So please go and consult the right person, which is a qualified urologist. डॉक्टर, द थिंग इज कि जैसा कि आपने बताया कि अगर ये सिम्पटम्स हैं तो डेफिनेटली जब कोई आपके पास आता है और आप डायग्नोज करते हैं, अगर वो बीपीएच है तो फिर उस तरह से
Mhm.
ट्रीटमेंट्स होते हैं।
Definitely.
अगर जो पेशेंट है उसको सिम्पटम्स नहीं हो रहे हैं तो भी क्या आफ्टर अ सर्टेन एज रेगुलर चेकअप्स कराने चाहिए, ताकि पता चल सके कि क्या प्रोस्टेट में
Definitely.
एनलार्जमेंट। ईस्टर्न कंट्रीज में तो पीएसए भी आई थिंक कई ऐसी कंट्रीज हैं जहाँ कंपलसरी है आफ्टर सर्टेन एज
Mhm.
एवरी ईयर
Definitely.
स्कैनिंग कंपलसरी है। हमारे देश में उस तरह से कंपल्सरी तो नहीं है, लेकिन क्या ये जरूरी है कि हम डॉक्टर को दिखाएं हर साल?
Not har saal, but definitely patient should get himself evaluated after age of 50, at
हम्म।
least once or twice a year. Not for prostate, then other diseases as well. A lot of
हम्म।
things comes up. So he should visit a doctor once a year and get his all profiles done. And even if the prostatic symptoms are not that severe, you don't know the patient is the mentality of our society. They
हम्म।
might be ignoring the symptom. They might be ashamed of going
Right.
to a doctor. So
हम्म।
even if we come to a doctor, he might be feeling secure by himself and might talk in a closed door, which he is not able to talk
हम्म।
to with his family or any relative
Right.
or his wife. So I think any person more than 55, 60 years of age should consult a urologist and so should talk to him once a while, so that there are a lot of things he can talk about and get rid of his problems, which he is not able to express himself in the family.
आई कम्प्लीटली सेकंड यू ऑन दैट। और वाकई में ये टैबू टॉपिक्स होते हैं और हम डिस्कस नहीं कर पाते हैं, कई बार घर पे ही डिस्कस नहीं कर पाते हैं। तो एज अ फैमिली मेंबर आल्सो वी कैन सी और चेक कि अगर हमारे घर में एल्डर्स हैं एंड दे आर कंटिन्यूअसली गोइंग टू द लू, और दिन में दे आर वेरी टायर्ड और लग रहा है कि सही से रात में नहीं सो पाए हैं, तो एटलीस्ट वी कैन ट्राई टू फाइंड आउट कि क्या रीजन है। और अगर इस तरह के
Definitely.
symptoms हैं, then we can play a very vital role here by convincing the patient to go and consult a urologist, because treatment is there, आपको relief मिलेगा। लेकिन बस जरूरत इस बात की है कि आप आइडेंटिफाई करें कि ये सिम्टम्स है। कई बार तो ये भी डॉक्टर होता है कि हम, जैसा जो हम शुरू में डिस्कस कर रहे थे, कि हमको लगता है कि ये सब एज रिलेटेड है, तो हमको लगता ही नहीं है कि कुछ एबनॉर्मल हो रहा है, हम सब मान लेते हैं। अच्छा, रात में हम 5 बार भी अगर उठ रहे हैं तो भी हमें लगता है कि नहीं नहीं, ये तो ठीक है, नॉर्मल है, ये तो होता ही है। वो ये कोई एक मेडिकल कंडीशन है, इसका इलाज है, कई बार तो ये भी नहीं पता होता है। डॉक्टर, क्या लाइफस्टाइल मॉडिफिकेशन भी एक इम्पोर्टेंट रोल प्ले करता है? बिकॉज़ व्हाट
Right.
हैपेंस, पानी को लेकर हम बहुत ज़्यादा पानी पीने लगते हैं, स्पेशली आफ्टर अ सर्टेन एज। मान
Mhm.
लीजिए ये सिम्पटम्स है भी और उसके बाद भी हम रात में जब अपने आप को अवॉइड करने के लिए उठ रहे हैं, इवन इमीडिएटली आफ्टर कमिंग बैक फ्रॉम द फ्लू विल हैव 1 फुल ग्लास ऑफ वाटर एंड देन विल गो टू स्लीप। फिर जब उठते हैं तब कई बार ये प्रैक्टिस होती है। सुबह कई हमारे ऐसे घर के मेंबर्स होते हैं, स्पेशली एल्डरली पीपल, जो एक साथ 1 डेढ़ लीटर पानी पीते हैं और उनका यही मोटो होता है कि जितना ज़्यादा हो सके पानी पियो, उतना ज़्यादा
Unappear.
अच्छा है हमारे लिए। तो ये सही है या क्या इसमें भी मॉडिफिकेशन की ज़रूरत है?
Basically, ये सही नहीं है. Like drinking, we need to drink a lot of water. Like
हुँ,
I would suggest not a lot, like 4 liters, 5 liters, but I
एडिक्वेट
think
वाटर इज़
in
इम्पोर्टेंट।
winters, go 2 to 2.5 liters or 3 liters is sufficient. But
हुँ,
one should distribute in a day. What I advise to my patients always is keep your 2 bottles in the morning, drink a glass, keep that bottles there. You need to finish those bottles till night. So they distribute that thing throughout the day, drinking a glass, in 2 hours, after 2 hours, after 3 hours, and then they can have good amount of liquid and throughout the day, but not having that problem of frequency of urine by drinking a liter of water by together, and all those problems are there.
हुँ, हुँ, हुँ।
So, and life coming to lifestyle modification, lifestyle of the patient, it plays a very high important role in the benign prostatic hyperplasia because it is associated with alcohol drinking, smoking, fatty diet. It is also known as a rich man's disease as well because more of the rich people are having this problem because of their sedentary lifestyle, stressful lifestyle, their eating habits, fatty foods, fast foods, liquor, smoking, all these problems. So it is more common in rich people use.
रिच मेंस
Yeah.
ये भी एक अच्छा टर्म है। तो
Mhm.
ऐसे में स्मोकिंग, अल्कोहल कंजम्पशन, ये भी हमें
Definitely,
कम या बंद करना होगा, राइट?
definitely. You need to get a hold on these things, and I think it helps in the patient.
राइट। बिनाइन पर तो हम बात कर ही रहे हैं, प्रोस्टेट एनलार्जमेंट पे,
Mhm.
और इस पर हम आगे भी बात करेंगे डॉक्टर, बट वी वुड आल्सो लाइक टू टॉक अ बिट अबाउट द कैंसरस एनलार्जमेंट ऑफ प्रोस्टेट।
Mhm.
कितना कॉमन है ये? एंड सेकेंडरी, जब तक मुझे पता है, नॉर्मली कैंसर के लिए कहते हैं कि कैंसर सेल्स बहुत जल्दी मल्टीप्लाई करते हैं, बहुत जल्दी कैंसर फैलता है। लेकिन प्रोस्टेट एनलार्जमेंट के केस में अगर कैंसर है तो कहते हैं कि ये एक बहुत स्लो ग्रोइंग
So that's
कैंसर है। इज दैट
yeah.
करेक्ट? और किस तरह से इसे हम समझें?
Yes.
Yes, doctor.
Yeah, am I audible?
Yes, doctor.
Yeah, hi. Sorry. Yeah, hi, sorry.
No.
So talking about the cancer disease, it is quite common, more common than we think, especially in those people who have family history of any cancer, prostate cancer. If first cousin, first brother or father is having prostate cancer, so there is 40 to 50% chances that you might be suffering from prostate cancer. So in these people, I would advise to get PSA scanning since 40 years of age itself, right? And if you are not having a family history, still you need to get a regular checkup for prostate cancer, PSA levels after age of 55 or so. And it is, you rightly said, a slow growing prostate. There's a phrase, it says that you don't die because of prostate cancer, you die with prostate cancer. So it's such a slow growing prostate until unless it's a very aggressive form. If it is diagnosed at a younger age, so you need to be cautious about it because younger age prostate cancers are quite aggressive as compared to the older age prostate cancers and with family history. So these people need to be cautious. Otherwise, prostate cancer is not a very life-threatening cancer. It has a good management options, and even if it has metastasized, it has gone beyond the prostate. Still, there is a lot of medical management treatments which can well control the disease, and patient can live with the prostate cancer for a long time.
And what are the management options that we have for prostate cancer?
So for prostate cancer, if it is a localized disease, so the best option is radical prostatectomy. That is a open or a robotic or a laparoscopic surgery in which the whole of the prostate with the capsule and everything is removed. And if even it is metastasized, it's an advanced stage, then there are a lot of medical treatments like androgen deprivation therapy, radiotherapy, castration of the patient, orchidectomies and all, which have good results. There are a lot of new medicines coming up in the market which almost control the growth of the cancer and does not allow it to grow at a rate that it should be growing, and which gives a life expectancy of 5 years to the patient a lot.
Right.
So I
Uh,
think it's
Again, we know डॉक्टर कि कैंसर के केसेस में योर एज प्लेज अ वेरी इंपॉर्टेंट रोल बिकॉज
Mhm.
बहुत सारे ऐसे ट्रीटमेंट है जो बॉडी ले ही नहीं पाती आफ्टर अ सर्टेन एज. तो इस केस में क्या होता है अगर प्रोस्टेट
Mm.
80s में या 90s में डिटेक्ट होता है प्रोस्टेट में कैंसर है तो क्या करते हैं?
See, the basic life expectancy of an Indian man is, I think, 65 or 70 years. If
हम्म.
he is 80, I would never suggest that patient, even if a localized disease, to go for a radical surgery because it's a big surgery, right? So in those patients, you can directly give them the option of these medicines. They just need to take some few tablets, not even some injectables, few tablets a day, and that can well control their prostate enlargement and all those things. And if they are associated with some low urinary tract symptoms like we of urinary symptoms, so you can just do a endoscopic procedure for them to ease their life, to ease their micturition, their urinating pattern, and you can give them a supplement of these medicines, anti-androgen deprivation therapy, which we call, and definitely they can live a long way with that.
बिल्कुल. तो प्रोस्टेट कैंसर पर भी हमने बात की. वापस हम बीपीएच पर बात करना चाहेंगे. अगेन पीपल इवन इफ दे नो कि ये होता है आफ्टर सर्टेन एज मेन में प्रोस्टेट एनलार्जमेंट एक बहुत ही नेचुरल प्रोसेस है. स्टिल
Right.
कई बार बिकॉज इट्स अ स्टिग्मा थिंग सोशल टैबू है, इस पर हम
Mhm.
डिस्कस नहीं करना चाहते हैं, हम डॉक्टर के पास नहीं आना चाहते हैं. लेकिन हमारे पास आजकल सोशल मीडिया है, सोशल मीडिया पर इन्फ्लुएंसर्स हैं, हमारे पास
Definitely.
इंटरनेट की दुनिया है जिसमें हम जो भी टाइप करते हैं बहुत सारा इन्फॉर्मेशन आ जाता है. वो इन्फॉर्मेशन कितना क्रेडिबल है वो एक अलग मसला है. तो ऐसे में वी कीप ऑन ट्राइंग एंड टेस्टिंग, या बहुत कुछ हुआ तो एक केमिस्ट के पास चले गए कि ये
Mhm.
प्रॉब्लम हो रहा है, कुछ एक इसका क्विक सोल्यूशन दे दो. डॉक्टर के पास जाने से हम हिचकिचाते हैं लेकिन अपने लेवल पे इस तरह की चीजें हम बहुत करते हैं. इज इट अ गुड प्रैक्टिस या इसके और कोई रिpercussions हो सकते हैं डॉक्टर?
Uh, Actually, going to like just going out through the Google knowledge and going to chemists and taking any medicines and just a chemist giving a regular medicine or a patient reading a prescription. You know what the chemists do nowadays? They read the prescription of a doctor
Hmm.
and they prescribe the similar medicines. They're
Hmm.
not educated, they're not qualified enough to do that, and they do that. I've seen a number of like patients coming to the I have taken this medicine from that chemist and all this. They actually read the prescription of a doctor when they get
Hmm.
there and they give the similar medicines. So actually they don't know what the side effects of these medicines are. So the only provision what I think for this is to bring our word to the maximum people we can and educate them that instead of going to a normal quack, normal
Hmm.
chemist, even if you cannot afford a fees of doctor, you can request any doctor and he can see you for free even.
Hmm.
But take a right advice because
Right.
money does not matter at the end. It matter what we everything. You know, money is important, but the patient health and welfare comes first. So we need to bring that word to the patient that you don't need to have that mindset that doctor गए तुम्हारे इतने पैसे लग जाएंगे इतने ये लग जाएंगे. You need to come up with डॉक्टर सर हमारे पास नहीं है पैसे हम इलाज कराना चाहते हैं. I don't
एटलीस्ट एक
think there would be
कंसल्टेशन तो ले ही सकते हैं बिकॉज अगर आप ओवर द काउंटर
बिल्कुल
प्रोडक्ट्स भी ले रहे हैं दूसरी चीजें भी कर रहे हैं तो उसमें आप जो खर्च कर रहे हैं उससे तो अच्छा है कि एटलीस्ट एक बार डॉक्टर से आप कंसल्ट तो कर
कंसल्ट.
लीजिए
और अगर
राइट
आप किसी मेरे को नहीं लगता कोई भी डॉक्टर कोई पुअर पेशेंट जेन्युइन पुअर पेशेंट को फ्री कंसल्टेशन देने से भी मना करेगा
राइट
if he thinks that it's at least I would never do that. So definitely
और
we
कई
need to
बार
take that way.
गवर्नमेंट इनिशिएटिव से भी और डॉक्टर्स के भी कई ऐसे ग्रुप्स हैं जो इस तरह के कैंप्स लगाते हैं
Definitely, we do the camps. They can definitely visit the camps. They can find out what the if they're having that much of thing searching on Google, they can definitely search for camps as well.
राइट
And they should search for camp, having an educated doctor over there and consult him over there.
use your internet connection to the right use तो उसपे आप
Right.
किस तरह की इंफॉर्मेशन ढूंढना चाह रहे हैं वो इम्पोर्टेंट है
So,
आप ये
बहुत
ढूंढिए कि
important.
आपके आसपास कौन एक अच्छा यूरोलॉजिस्ट है जिनके रिव्यूज अच्छे हैं उनके पास जाइए या फिर अगर आप कैंप्स या दूसरे हेल्थ ग्रुप्स की तलाश कर रहे हैं वो करिए लेकिन अपनी बीमारी के बारे में गूगल मत कीजिए प्लीज गो टू द राइट पर्सन एंड इन case it's a urologist who can help you out. Please go and consult your doctor. That's really important. कुछ सवाल हमारे व्यूअर्स के हैं डॉक्टर वो भी हम लेते हैं फिर हम आगे बातचीत जारी रखेंगे दीप है हमारे साथ और इनका क्वेश्चन है आर देयर एनी मेडिकेशन दैट कुड एग्जैजरेट बीपीएच सिम्टम्स एंड शुड आई अवॉइड देम अगर दूसरे कुछ मेडिकेशंस
Yes.
चल रहे हैं?
Yes. The medicines which we take for asthma and which we take for cough, like tolterodine and etc. These acts as these are alpha blocker agonists basically. They act in reverse to the medicines we give for the prostate. They act by contracting the bladder neck, so they can increase the symptoms of these patients. So you need to be cautious taking these medicines. And also, if you are hypertensive, you are a diabetic, you need to tell your doctor and you need to modify some medicines if you are taking medicines for prostate as well.
Right. We have one more viewer with us, Rajat. His question is, Doctor, can BPH increase the risk of developing other health complications? And if so, what are they? And इसी से जुड़ा हुआ एक सवाल मैं भी डॉक्टर आपसे जानना चाहती हूँ मान लीजिए कोई है जो ये साइंस को इग्नोर कर रहा है या मान लिया है कि ये एजिंग से रिलेटेड है इसके साथ तो जीना ही है और
Mhm.
बहुत लंबे समय तक हम डॉक्टर को नहीं दिखा रहे हैं और तो वो कितना सीरियस हो सकता है व्हाट आर द पोटेंशियल कॉम्प्लिकेशंस इफ इट इज लेफ्ट अनट्रीटेड?
Uh, I would say it's dreadful if he is ignoring because what I usually explain is like urine is water. So water finds its way out, right? So if it's not able to find its way out of the body, whatever it will do, it will go back to your kidneys from where it's being produced. There's a valve mechanism at the bladder and the kidneys which avoid that backflow. But if there is a lot of residual urine and you're ignoring and you're putting pressure on that, it will keep on pushing it back with the back pressure, leading to damage to your kidneys even, and it can cause a dilatation of your kidneys, back pressure infections, pyelonephritis, and infection in your kidneys, causing a dreadful scenario for the patient. So, patient, I would suggest never ignore these problems. Not a that easygoing thing if you ignore it. Also
Right.
with long term, when there's a obstruction, so your bladder keeps on pressing against that obstruction. But at a time that bladder, tires up. It
Hmm.
loses that power to do the compression. So it
Right.
gets its nerves and all the supply damaged. So it turns out to be a neurogenic bladder. And once that neurogenic bladder is there, I would tell you take medicines for life and it won't be relieved. So
तो उस
you should
नौबत तक
always
राइट, तो बिल्कुल
go for it.
वो नौबत ना आए, और इसलिए बहुत ज़रूरी है कि इनिशियली जैसे ही ये सिम्पटम्स आपको दिख रहे हैं, प्लीज़ गो एंड कंसल्ट द डॉक्टर, दैट्स रियली इम्पोर्टेंट। डॉक्टर, एक तो ये है कि अगर ये साइन्स है तो आपको डॉक्टर को दिखाना है। कई बार तो इन साइन्स को हम बहुत नॉर्मल मान लेते हैं। कई बार पेशेंट्स होते हैं, जब वो डॉक्टर उनसे पूछते हैं कि आप रात में कितनी बार उठते हैं? तो कहते हैं 5 बार उठते हैं। दैट्स ओके, मतलब रात में तो उठते ही हैं।
I'll tell you
और
70% of my patients are does that.
तो कई बार पता ही नहीं होता है, एक तो वो किस तरह से चेंज आ जाता है कि हम रात में 1 भी बार नहीं उठ रहे थे, फिर हम 2 बार उठने लगे, फिर हम 4 बार उठने लगे,
Mhm.
और हम सब में एडजस्ट हो जाते हैं। ये हमारे
Right.
सोसाइटी के लोगों की एक
Right.
खासियत भी है, हम सब कंडीशंस में एडजस्ट हो जाते हैं, एंड वी डोंट इवन रियलाइज कि हम
So we have a good threshold for the pain and the problem.
राइट, दैट्स
That's how
ट्रू।
Indian society it is.
राइट। तो ऐसे में अगर हम बताना चाहें हमारे व्यूअर्स को व्हाट इज नॉर्मल एंड व्हाट इज नॉट नॉर्मल, हाउ मेनी टाइम्स टू गो, स्पेशली ड्यूरिंग द डे एंड ड्यूरिंग द नाइट, नॉर्मल कंसिडर किया जाता है, और अगर इससे ज्यादा आप जा रहे हो तो वो नॉर्मल नहीं है, प्लीज गो एंड कंसल्ट द डॉक्टर। तो वो क्या
So
नंबर है?
in a old age person, I think once waking up at night might be considered as normal sometimes. Waking up more than one times is not normal at all. Waking up two, three, four times is not normal. Definitely, if the person is having alcohol at night or coffee at night and he's waking up two times, that can be considered as normal. But he should avoid taking all these beverages at the bedtime. Tea, coffees, and alcohol should be avoided at the bedtime. In a daytime, if he need to rush to the washroom, if he has always that urge to urinate, or if he has that urgency and he's getting that I'm not able to stop, I need to rush to the washroom, I cannot stop, that's totally abnormal. And if he is menstruating more than once in an hour or 1.5 hour, so it's that is abnormal.
अच्छा, कई हमारे घर पे भी हम देखते हैं कि कई हमारे घर में बुजुर्ग होते हैं जो दे आर नॉट गोइंग टू अ पब्लिक फंक्शन और फॉर सोशलाइजिंग, और उनसे पूछो कि क्यों नहीं जा रहे हैं, तो दिल से वहाँ वॉशरूम कहाँ ढूंढूंगी, और या कहाँ ढूंढूंगा वॉशरूम, बिकॉज वी आर टॉकिंग अबाउट फ्रॉस्टेड,
Mhm.
एंड ये एक बहुत बड़ा कंसर्न होता है। तो अगेन, अगर ये प्रॉब्लम भी हम घर में सुन रहे हैं हमारे
Definitely.
किसी एल्डरली मेंबर से, तो देन वी शुड टेक देम टू द डॉक्टर, राइट?
Right, right, definitely they should consult a doctor because there is definitely some underlying problem in a certain age. In females also, like prostate, in females also, the thing is when the deficiency of estrogen occurs after menopause. So what happens is their external matrix gets lost, and they also develop similar symptoms to the what is being caused in males by the prostate. That is obstructive symptoms. So even if a female is having this problem, they have to wake up. They also need to get evaluated as well. As we talked, you just mentioned female thing, so I just thought let's mention that as well.
Right, right. And doctor, what can a person do to maintain his prostate health? एक तो आपने बताया कि अगर फैमिली हिस्ट्री है प्रोस्टेट कैंसर की, या फिर एक एज से पहले अगर आपको प्रोस्टेट कैंसर हो रहा है, देन यू शुड बी कॉशियस, और कोई बात जो हम ध्यान में रख सके टू कीप आवर प्रोस्टेट हेल्दी?
See, the lifestyle is the basic key to make the prostate healthy. If you are having a good workout daily, you are having a healthy lifestyle, you are not having alcohol daily basis or weekly basis, occasional alcohol intake, or you are not having smoking, is a big risk factors for prostate enlargement. So if you are avoiding these things, it is the best thing you can do to help your prostate grow in your favor, because it's gonna grow at any way, any cost, it's gonna grow, but you need to make it grow in your favor. So if you want to make it grow in your favor, you need to avoid, take up a healthy lifestyle, go for a regular walk or exercise, go to a gym or do anything, but keep yourself active, not a sedentary lifestyle and a fatty lifestyle. That's just.
Right. And before we sum up the whole session, doctor, any take home message, क्या करे क्या नहीं करे?
क्या करें ना क्या ना करें, we have already discussed, but ignore na karo. That's the only thing I
Right.
would like to say. Please do not ignore your problems. Come up to a doctor, talk to him, maybe alone, maybe with your family, as per your comfort levels. Don't go to the quacks. Don't go to uh, some uneducated person who's saying that मैं ये कर दूंगा, ये जड़ी बूटी ले लो, and etc. What they ever say in our society. But consult a educated, well qualified doctor, and don't ignore your problems ever. And I think if a problem is held at a time, it can be well solved without any intervention as well.
बिल्कुल, जितनी जल्दी हम डॉक्टर से जाएँगे मिलने और जितनी जल्दी डायग्नोस होगा, उतनी जल्दी ट्रीटमेंट शुरू होगा, उतना आसान होगा, उतनी जल्दी आपको आराम मिलेगा। और जितना आप बहुत ज़्यादा इग्नोर करके या बहुत से प्रॉब्लम्स बढ़ जाए, सिम्पटम्स आउट ऑफ कंट्रोल हो जाए, तब डॉक्टर के पास जा रहे हैं या दूसरी चीज़ें ट्राई करने के बाद जा रहे हैं, तो हम इतना वक़्त ज़ाया कर लेते हैं कि वो प्रॉब्लम बहुत कॉम्प्लिकेटेड हो जाती है और ऑफ कोर्स ट्रीटमेंट लंबा हो जाता है। तो उस झंझट से बचने के लिए बहुत ज़रूरी है। एक प्रॉब्लम है, लेकिन उस प्रॉब्लम का सॉल्यूशन भी है और सॉल्यूशन तभी मिलेगा जब हम डॉक्टर के पास जाएँगे, सही डायग्नोसिस कराएँगे। Thank you so very much, Dr. Sagar Bassi. It was wonderful
Thank
talking
you.
to
Thank
you.
you.
Thank you for
Thank
this very informative session.
Thank you. It was really nice talking to you. Thank you.
Thank you, Doctor, and viewers. Thank you for your excellent participation. For more information and updates, stay connected on our FB page, Bladder Wellness. We are also available on